What's up, everyone? This is Dr. Webb here, and today I'm going to be talking about a question that I get a lot. I get a lot from pre-med students, I get a lot from medical students, and that question is there a difference between MDs and DOs? And what are my thoughts on the two? To answer that question very broadly, the answer is no. There's really no big difference between a MD and a DO. They both go to medical school for 4 years, and both go through a residency training, depending on your specialty, from 3 to 7 years, and you're able to practice medicine in the United States or whatever country that you're in. The differences are there are a lot more of MD schools in the U.S., and DO schools generally accept students with lower scores as well as lower GPAs. As far as treating patients, you have the same amount of kind of clinical expertise, but osteopathic medicine doctors usually try to treat the patient as a whole, and they try to treat patients, try to think of ways or things that can be causing, say for instance, a patient comes in with high blood pressure. They'll try to look at ways and things that can be causing the patient to have high blood pressure. Look at the whole picture. And they use a lot of manipulation in clinic and other type of strategies to treat patients without, heading to a pharmacological pathway, when first seeing them. The only two differences I think, or the main difference I think between the two, are the initials behind your name. So one has a MD, you go to an allopathic type medicine approach, and DO is Doctor of Osteopathic Medicine, and you take the osteopathic approach towards treating your patients. I work with both types of physicians, DOs, MDs who are surgeons. I know a DO here in town who's a orthopedic hand surgeon. I know a spine surgeon who is a DO. I know lots of different MDs, and you really can't tell the difference. If you're just talking to one or see one treating a patient, you really can't tell the difference. I think a lot of people who have lower scores or who have been out of school for a while, they may apply to the the osteopathic medicine schools, or may try to get into an MD school and can't get in, and then apply to a DO school. Or there are a lot of students out there who just like osteopathic medicine, that type of that training, that philosophy. So I think it just varies on the person who and the reason why you apply to a different school. A lot of people don't know this. When I was applying to medical school and I got rejected my first 2 times of applying to allopathic school, I wanted to be a doctor, so I didn't care whether it was an MD or I didn't care whether it was a DO. So I applied to both programs, and I actually went on a few interviews for osteopathic medicine because I wanted to be a doctor, and I wanted to do. I was willing to do whatever it took to be a doctor. So my advice to you guys, if you want to be a doctor bad, and if that's something that you really want to do, I would apply it to both MD schools as well as DO schools. The problem that I can foresee that you have if you're going to the osteopathic route is when you apply to residency. It may be a little bit of hassle, but it can be done. But you do have to take the allopathic boards for MD in order to get into a MD residency program. There are not a lot of osteopathic residency programs out there, so it may be a little bit more competitive when you're applying to residency. Other than that, if you want to be a doctor, I say apply to both routes. There's really no big difference that I've seen over the years working with both types of doctors. The only big things are the initials behind your name, MD versus DO. This is Dr. Antonio Webb. If you have any more questions, email me at overcometheoddsbook@gmail.com, or hit me up on my website, AntonioWebbMD.com. See you next time.